Hi guys, here's another video on behalf of hipflexor.org, and this time we're going to look at hip pain. So quick background about the hip is, when we refer to the hip, some people refer to the whole hip region where the hip flexor obviously connects, so there's a lot of interconnecting between the two. The hip itself is the hip joint, which is where the pelvis connects to your femur being your thigh bone, the longest bone in your body. So you see in this diagram, there's a whole ton of cartilage, fluids, bursas, ligaments, a lot of things. It's a complex joint because it has to do so many different things for us. So because it's so complicated, there's a lot of different things that could affect it. So there's several types of injuries, but here's the main ones that we'll go over. There are conditions, things like arthritis, which is a result of cartilage being worn away. There's bursitis, which is when bursas become inflamed. These kind of things, they're painful. Bursitis, especially, is painful when you touch it. Arthritis it starts as like a numb pain, nothing too substantial, but over time you'll see it get worse. And if you don't catch these early enough, they can be like really dangerous, and you may need to get something like a hip replacement. There are hundreds of conditions for the hip, so it's one of the hardest places to diagnose. There's also hip flexor injuries. Okay, you can watch our other video on hip flexor injuries, but typically when people complain of hip pain and it comes down to something like a hip flexor injury, it's going to be something like tendonitis or snapping hip syndrome. So if you hear a snap, or if it hurts after doing an activity for a while, it could be a sign of a hip flexor injury, which typically isn't as serious as a hip condition, but still you want to get this fully diagnosed. And then finally there's fractures, pointers. Pointers are just basically contusions, bruises. And fractures, obviously, there are multiple places that you can have a fracture typically on the femur side of the hip joint. But depending on where it is, that can have different complications. And it can even lead to other conditions by like cutting off the blood flow and things like that. So just to wrap this up, we have tons of articles about hip injuries. They're very connected to hip flexors. So go to hipflexor.org, read around a bit. But ultimately, if you're experiencing like a decent amount of pain or discomfort, go see a doctor as soon as you can. A lot of these conditions are easily treatable, or at least manageable if you catch them early. But if you don't have the proper diagnosis, obviously you can't do that, so it's risky to do it by yourself. You can get all the proper tests and things done, so just go see a doctor, get it confirmed, and if it's nothing or nothing serious, then it doesn't hurt you anyways.